Joining us today will be Dr. Christine Nefsey, Chief Medical Officer from Munson Healthcare, as well as Dr. Christopher Ledke with Munson Healthcare Infectious Disease. Now, I want to remind you, if you're joining us on Facebook, you can enter your questions at any time by using the comment. And if you're one of the media joining us today through Zoom, please use the Q&A function, and we will have both of our panelists on at the end to address all of those questions. Next slide, please. And with that, we will begin with an update on the status of COVID around our region, state, and the nation with Chief Medical Officer Dr. Christine Nefsey. Dr. Nefsey.
Thank you, Brian. So we'll start with the national map here, and you can see based on the color that Michigan still remains a hot spot, although we are seeing our numbers trend down, which we'll go into in just a second. Next slide. So here you can see all of our surges, and the peak for the prior two were at 11.6 and 17.7. You'll recall we peaked quite a bit higher than that 17.7, but the good news is that today we are at a 16.7% positivity rate on a rolling 2-week average. So that is down from where we have been the last few weeks, which is good news. We still, and these numbers do tend to lag behind that positivity, see a high number of inpatients for COVID among the Munson Healthcare hospitals. We are at 103 today, which is down from our peak at 146. Next slide. And here you'll see the graphic of those patients and the breakdown of who is hospitalized for COVID-19 is vaccinated versus unvaccinated. And you can see from those numbers there that still the vast majority of people hospitalized in our Munson Healthcare system for COVID-19 are unvaccinated. And those percentages get even more significant as you look into our ICUs and our ventilated patients. Next slide. Here you can see a graphic that just shows the age groups for who are the highest cases that we're seeing. And you can see we still tend to see kind of those younger school-age children, 10 to 19, and then the younger population as leading the way, so to speak, in our number of new cases. Again, though, you can see a downward trend across the board in all age groups. Next slide. And then we are starting to see a little bit of influenza. We haven't had any huge outbreaks yet, thankfully, but we are starting to see cases throughout northern Michigan. So again, something that we're keeping our eye on and something that we are somewhat concerned about as we move forward through the COVID pandemic. Next slide. So just some questions about vaccination. So you could see from that prior slide how effective vaccines are in preventing the spread of COVID-19. Vaccines are also effective in spreading the spread of influenza. But just to show you the breakdown on boosters, because as we head into the predictions about the Omicron variant, we know that being vaccinated and specifically fully vaccinated with a booster is the most effective way to prevent getting that new variant. So you'll see here the breakdown of with which vaccine you may have received earlier and then how long before you can get the booster. So really with the mRNA vaccines, you can see if your last shot was 6 months ago, you are due for a booster. Your immunity is waning. And so you can see there that breakdown. And then if you received Johnson & Johnson and it's been at least 2 months since that shot, you should get a booster. Next slide. So again, you know, we are heading into the holidays and people ask what they can do. I will repeat again, getting vaccinated and specifically getting vaccinated with a booster shot is the most effective thing you can do in preventing getting and spreading COVID-19. If you are in an indoor setting, please wear a mask. If you are in public, you should try to maintain social distancing as much as possible. You should try to ventilate any indoor spaces as much as possible. And that can be anything as expensive as, putting in new air control systems and filters and those kinds of things, to as simple as opening a window. Wash your hands frequently, especially if you are preparing, eating, or serving food. Communicate with people if you are having gatherings over the holidays. Just ask if they're vaccinated. Ask about some ground rules. If you want to get together with people who are not vaccinated, it's entirely appropriate to ask if they get a test before they come to your home. And again, if you are feeling ill, even if it's mild, runny nose, tickly throat, just not feeling well, please don't travel. Please get tested. Next slide. If you are looking for resources for either vaccination or testing, local health departments, your primary care provider, many of our pharmacies around our region have all of those things available. You can get on the www.michigan.gov/coronavirus website and find a testing site based on your zip code. There are also hotlines you can call through the state as well as through Munson Healthcare to help you navigate that as well. That was it for me.
All right, thank you, Dr. Nefsi. It's even though hospitalizations remain high, it's nice to see those numbers on a downward trend. We'll move to the next slide now, and Dr. Nefsi will bring you back here in just a few minutes for the Q&A.
Great, thanks.
Even as we see those numbers decline, though, there is a new variant that is in all the headlines right now. It is becoming a predominant variant across the country. And so we want to bring in Dr. Christopher Ledke with Munson Healthcare Infectious Disease to give us the very latest on the Omicron variant. Dr. Ledke.
Thanks, Brian. So I wanted to give a concise review of Omicron, and I apologize in advance if it is technical, if there's some more detailed medical information. I apologize for that, but hopefully it's useful. So Omicron was declared a variant of concern on November 26th. And in order to become a variant of concern, you either have to be more transmissible, more severe in illness, or be able to evade the immune system. So I wanted to review what Omicron does to meet some of those criteria. The reason we were concerned about this variant in particular is the amount of mutations. So it has over 50 significant mutations, of which 36 are on the spike protein. And we've seen, based on past variants, that with these mutations, the variants can behave quite differently. It's almost like a new pandemic develops within a pandemic. And we've been through this before. So basically what happens is that the virus replicates in a host very, very rapidly in billions of times. So that is prone to errors. And most of those errors create a mutated virus that isn't viable. But every once in a while, it will create a virus that has different characteristics that allow it to become more fit, more transmissible in the community. And when that happens, you get a new variant that spreads rapidly. So in Michigan, Delta is still the dominant variant, but Omicron has been detected in 6 counties, including Genesee, Macomb, Oakland, Washtenaw, Wayne, and Kent, where the first Omicron case was identified. It's likely that the true burden of Omicron is probably much higher than this. We rely on sequencing at the state level to identify which COVID cases that we submit are Omicron, and there is a delay in that, and they only do a small percentage. So it's likely that there's more spread than what we're aware of. It's also been identified in 44 states in the US, and as of yesterday was technically the dominant strain nationwide. So it appears to be much more transmissible compared to Delta. It's about 4 times more contagious from what we've seen so far. In reality, it's one of the most contagious viruses known to man. A look at what's happening in South Africa and the United Kingdom gives us a glimpse of what we can expect. Omicron there has become dominant and has been creating surges for weeks. So they're ahead of us in that regard, so we can see what's going on there. Significant surges, particularly in South Africa, where they saw a 2,000% increase from late November to early October, which is one of the highest 2-week increases since the beginning of the pandemic. It took less than 2 weeks for Omicron to become dominant in South Africa, whereas Delta took over 6 weeks to make that switch, and that occurred earlier in the summer. As far as hard numbers on how transmissible it is, it has a doubling time of 1.5 to 3 days, which means that in a 1.5 to 3 day period, the amount of new cases in a population will double, which is extremely fast. The effective reproductive number, which is the amount of secondary cases for every primary case in a mixed susceptibility population, which is what we have, is somewhere between 3 and 3.5, which means that for every primary case of Omicron, we would expect 3 to 3.5 new cases, which is very high. We've seen how transmissible it is based on specific outbreaks. In particular, a few I'd like to mention: a Christmas party in Norway in late November with 120 community members attending this party. 70 of them became infected with Omicron within a week. And interestingly, 50 people at that venue, not at the party, but at the venue within a week also became infected with Omicron. A school Christmas lunch in Denmark with 150 school children, 64 of them became infected with Omicron within a week. A birthday party in the United Kingdom, 18 attendees, 14 became infected within a week. Interestingly, this Christmas party in Norway, we have decent data on what the typical symptoms were for these patients and how rapidly it occurred. It appears that the incubation period based on this preliminary data is fairly short. It was closer to 3 days, whereas Delta was closer to 4 to 5 days, and the ancestral non-mutated strain was more like 5 or 6 on average, although there were wide variations. So it appears that the incubation period is shorter, which means from exposure to development of disease seems to be shorter. And interestingly, the second most common symptom besides cough was runny nose and nasal congestion based on the patients at this Christmas party. So it appears to have a high attack rate, even among the vaccinated, though among these outbreaks that I just mentioned, none of the patients were hospitalized and the cases in general were quite mild. There is some possible biologic explanation for that. There was a report out of Hong Kong looking at modeling with lung tissue and respiratory tissue and determining where anatomically Omicron is causing infection. Appears to be very good at infecting respiratory mucosa, meaning airways, nasal passages, and a significant amount of virus is shed from those sites, which is probably part of the reason why it's so incredibly contagious. It did not appear to invade lung tissue nearly as well, which may be why it's not as severe. Although again, this is in vitro laboratory data, may not reflect what actually happens in a human body, but it is compelling. I'd like to talk about severity. Preliminary data out of South Africa suggests that it's much less severe, although again, this is preliminary. A snapshot of hospitalized patients in South Africa in early December: 42 admitted patients, of which only 6 were vaccinated. Only one of those patients was on a ventilator. That patient had chronic lung disease, and only 4 in the intensive care unit. The length of stay was less than 3 days. And so the percentage of patients that are critically ill and the length of stay was significantly lower than Delta when that was spiking in South Africa, which is good news. We are seeing a lower age profile, meaning it appears to be infecting younger patients. 80% of the hospitalized patients in South Africa thus far have been less than 50 years old. A report out of South Africa last week with a large portion of the population evaluated showed a 29% lower hospitalization rate with Omicron compared to Delta for adults. And interestingly, for those less than 18 years old, the incidence of hospitalization was actually 20% higher. So it appears to be, based on the preliminary data from South Africa, possibly less severe. I would, I guess, issue some caution that even with a lower incidence of hospitalization and death, it still has the capability to significantly overwhelm the healthcare system based on the transmissibility alone. I'm also concerned about first responders and essential workers and healthcare workers who have a high risk of developing Omicron and the amount of days lost, and that contributing also to the difficulties with our healthcare system. The severity data is not across the board. There is some discrepancy. A report out of the United Kingdom actually found similar rates of hospitalization and symptoms comparing Delta and Omicron, although the hospitalization in these reports was relatively low for both, so they claim that this was limited. Interestingly, in that same report from the United Kingdom, they found that the risk of reinfection was 5.4 times higher with Omicron compared to Delta, which means that those who had a prior COVID infection were 5 times more likely to get infected with Omicron when exposed compared to Delta. So I'd like to talk about immune escape in regards to vaccination and prior infection, which I just mentioned. There have been some preliminary lab studies looking at how well our antibodies after the vaccination protect us. Very small samples, but that's all we have so far. After a 2-dose of Pfizer, there was a 41-fold decline in the amount of neutralizing antibody levels for Omicron. The author of this concluded that he thought it would actually be worse based on the degree of mutations. And they concluded that those who were infected and vaccinated or had received a full series plus a booster could probably compensate for this loss of neutralizing antibody levels. And encouragingly, yet just yesterday, Moderna reported their preliminary data that showed a significant increase in antibody levels after a booster of 37-fold with a standard dose and 83-fold with a higher dose booster, which is twice the dose of what they're typically giving for a booster. Pfizer released similar data with a 25-fold increase in the amount of neutralizing antibodies after their booster. There is a Omicron specific booster in development. It is unclear if that will be necessary, but that is one of the benefits of an mRNA vaccine. You can alter that target to the circulating variant. It still obviously will need to be manufactured, distributed, administered. So there are huge barriers to that, but it is an option down the road. Unclear if it's going to be necessary or not, but it is in development. So a report out of South Africa last week reported a protective effect of about 33% with 2 doses of the Pfizer for infection. So a protective effect of 33% for infection itself, and then 70% for hospitalization and death. This is compared to Delta, where those numbers are 80% protection from infection and 93% protection from hospitalization and death. So a drop in vaccine efficacy for sure. Now, again, that is with the 2-dose Pfizer. That does not take into account those who are boosted. So again, we have preliminary data. There's still a lot to learn about Omicron. We've only been dealing with this for less than a month at this point. And we've learned a significant amount during that time frame, but there is still a lot to learn. It clearly is more contagious, clearly, and significantly so. It may be less severe, but again, that data, that information is preliminary, and we have more to learn on that. based on surges in other countries, we should expect significant transmission here in the US. And unfortunately, I think the next 2, 3, 4 weeks in particular are going to be very challenging for our country. So one compelling part of this is going to be, how do Delta and Omicron interact? Does infection with Omicron confer good protection against Delta or vice versa? We don't quite know that yet. It may be that Omicron is so transmissible that it infects a huge proportion of the population and those patients are protected against Delta. If it was a less severe illness, that would actually be a good thing. It's, it's not good to have big surges like that, but that would be one way how this plays out, but we don't know yet. Though vaccine effectiveness has declined, it still maintains a strong protective effect, particularly against severe disease and death, particularly with boosting. So again, as Christine mentioned, we are strongly recommending that anybody who is eligible for a booster, please go obtain that. We are recommending that children who are eligible to get vaccinated, please get vaccinated. You heard that the incidence of hospitalization based on data from South Africa would imply that this may actually be a more severe illness in those who are 18 and under. So another reason of many why children should be vaccinated. I'm sure that you who are listening out there are all very, very tired of dealing with COVID. And I can assure you that the healthcare workers in our system are also extremely fatigued and very tired of this. The best way that you can help our healthcare workers, our healthcare system who've been taking care of the community, is to go get yourself vaccinated.
Thank you, Dr. Ludke. I want to bring Dr. Nefsi back in for a little Q&A. We know that Omicron is extremely contagious. Dr. Nefsi, I know that you spend a lot of time talking with health officials around the region and around the state. What is being anticipated over the course of the next 4 to 6 weeks? Particularly as it pertains to the healthcare system and what we might be seeing in hospitals across the region.
Well, like Dr. Letke mentioned, we are hearing preliminary data from other countries and other places like New York. And so, we're trying to make what preparations we can, anticipating that while there is some data that shows milder cases, we still know that there are some people who are much more susceptible to developing significant illness from COVID-19. And so we really are expecting that our current downward trend is going to go right back up again. And so while this may be a respite, it's likely to be short-lived. And so we are really looking at, how we can continue to ensure that we have availability of medical care to all of our community members who may need it, whether it's related to COVID-19 or completely unrelated. So we are expecting to see more cases, both in the public generally, and then being seen in our clinics, in our urgent cares, in our emergency departments, and then admitted to our hospitals.
Dr. Ledke, we have a question regarding boosters. And if someone is immunocompromised, had a booster in the early fall, do they need a 4th dose?
Yeah, so the indication for 4 doses would be somebody who is immunocompromised and meets criteria for a 3-dose series. Okay, so those who are immunocompetent with a healthy immune system would start with a 2-dose series. Those who are immunocompromised would start with a 3-dose series. Okay, and then they would still recommend a booster, but that's not for 6 months. Okay, so that's when that comes into play. There's no indication for like 2 boosters. You just initially get your series, 2 if you're immunocompetent, 3 if you're immunocompromised, and then both of those populations should get a booster 6 months later. if that makes sense.
Thanks, Dr. Ledke. Dr. Nefsey, want to go back to somewhat of a follow-up question to what we just asked about what we anticipate. We're seeing numbers go down now, but what is the status inside the hospitals across Munson Healthcare right now, still with 103 patients as of today? Has there been, can you call this relief, and what is the current situation?
You know, I think it's important to remember that the numbers we're seeing today, even though those are a reduction from what we've seen over the past few weeks, are still where we were at when we made the decision to go to pandemic level red. So we are still very, very busy. The healthcare system is still quite stressed, not to the level that it was last week or the week before, but certainly compared to our prior two surges and where we are normally, a much higher level of acuity and volume.
Dr. Ledke, we received a number of questions about monoclonal antibodies, and I kind of wanted to go through those with you and start with the status of supply. How much is available, and to what patient populations are we able to provide that treatment?
Yeah, so we have been trying our best to treat as many patients as we can with monoclonal antibody, those who meet criteria. And we've actually been able to significantly increase the amount of patients that we've been treating to a point where we're fairly caught up. There's a fairly short delay in when you would have ordered it and when you would be receiving treatment. Some of that has to do with additional staffing. We also transitioned to a situation where we can give subcutaneous monoclonal antibody, which has helped a lot. One thing I would mention is, unfortunately, Regeneron, which is one of the monoclonal antibodies we are administering, and bamlanivimab, another formulation of monoclonal antibody, appear to have lower activity against Omicron. There is a monoclonal antibody called sotrovimab, which we have access to, which appears to have good activity, although our supplies of that are relatively low. So I think there are going to be major changes in the administration of monoclonal antibody over the next month as we get more information as to how effective these formulations are, and ideally get more supply of those formulations that are known to be more effective. So I guess what I would say is stay tuned. We're getting more information on that. We're trying our best to treat as many patients as we can. With what we know so far in Michigan, it appears that Delta is still predominant, although I think that is short-lived.
And in terms of where where monoclonal antibody therapy is being provided, in terms of what facilities, where are patients going to receive those therapies?
So many patients are receiving it at infusion clinics, and quite a few are receiving it in the emergency room. We've also had a pilot program of trying to administer as many as we can in the home for certain patients that meet criteria. So there's been kind of a mix, and it depends on the patient's situation and their location and things like that.
I will just say, Brian, though, we are offering monoclonal antibody across the Munson Healthcare system. And just to capitalize on Chris's prior comment, you know, those supply chain issues we've seen throughout this pandemic, you know, it's complicated, multifactorial, but we continue to see that, not just with medications, but with other supplies, and not just, you know, things that we use particularly for COVID. So we're seeing things like, you know, certain containers that we draw blood in, or catheters, or things like that, just because of the manufacturing process, how global we are, and then just adding, you know, lots of different reasons, whether it's weather or the pandemic or other, you know, staffing issues. We continue to see supply chain issues across the healthcare system.
Dr. Nefsi, a question here regarding vaccination rate among employees and the impact from early December's deadline to meet the CMS requirements. Where are we in terms of a vaccination rate among employees, and what was the impact in terms of employees leaving on that date?
So as of this morning, we were 97.5% compliant with the vaccine mandate. And I'm happy to say the impact on our staffing regarding that mandate was relatively minimal.
Another question here regarding, I think it's along the lines of severity of illness. What have we seen in terms of length of stay among COVID-19 patients during this Delta surge? How long has it been, maybe even compared to previous surges, or the overall average length of stay for a patient who isn't with COVID-19?
I mean, it's difficult to put a firm number on that because every patient is different. I will say overall, we think directly because of our high percentage of COVID-19 patients, our length of stay is higher than it typically is outside of a pandemic. These patients typically, especially if they're in the ICU, receive quite a bit of care. They're complicated patients. They have a lot going on. So, it really depends though. We have people who might be relatively healthy, no comorbidities that get admitted for COVID-19. They will generally have a shorter length of stay than somebody who has a lot of other illnesses or complicating medical history. But there's really no rhyme or reason. And that's been part of the problem. This would have been a lot easier if we'd said, if you have, heart disease and cardiac disease and this, you need to get vaccinated because you're going to get sick and be hospitalized. But the reality is we have older people who get it and do relatively well, and we have younger, what we would call, typically healthy people who get very sick and get hospitalized. So there's really no way for us to predict who's going to have a complicated course with COVID-19 and who's not. What we do know is if you get admitted for COVID-19, you're generally quite sick, and many of those patients receive quite a bit of intensive care.
Another question here regarding masking, and there was a decision to lift the mask mandate by TCAPS at the start of this coming year, and we've seen that in a number of different organizations across our region, across the state, across the nation. What is your recommendation right now with safety protocols, and do they change at all given the transmissibility? I mean, should we be wearing different kinds of masks? Should we really be ramping up social distancing and maybe reverting back to even more safety protocols that we were seeing in previous surges? What is your advice on that front?
Yeah, it's a great question, Brian. And, maybe Dr. Letke can weigh in more specifically with this variant. We do know it's more contagious. It is certainly behaving more as an airborne spread rather than a droplet spread, which is what we saw with previous variants. And so, certainly as the spread and contagiousness changes, we would change our recommendations for, how vigorous we are with masking or certain types of masking and distancing and those kinds of things. In regards to TCAPS and any other organizations, our advice all along has been to follow the science. And whether that's the science dictated by the CDC or the World Health Organization, the American Academy of Pediatrics, and we stand firm with that, is that our recommendation is to follow the science and those recommendations of those healthcare experts.
Yeah, so first of all, I appreciate the TCAPS school board. They work hard, they're volunteers. They had difficult decisions to make, and we've given our input. I think that now is not a good time to cut back on masking. One of the things that they were waiting on, I think, is for school-age children to have access to a vaccine, which is available now. And that's a good step, although the uptake has been fairly poor. I think about a third of those eligible within the TCAP system are vaccinated. So there are a lot of unvaccinated children. And with what we know about Omicron, unvaccinated, unmasked children in a classroom with this contagious of a virus will lead to high level transmission. So if you have a child in the TCAP system and you're listening to this, I would strongly recommend that you mask that child. So I have had KN95s on my kids for ever since the Delta surge started. They have done fine with them. They're commercially available. They have, based on literature, they appear to protect somewhat better than just the cloth mask. So I think personally a bigger concern in the next month or two isn't going to be masking or not. It's going to be whether they should be in person or not. Because I think if it's as contagious as we think, and if it really takes a stronghold in this area, I think that the level of transmission in schools could get really bad. So if you're listening to this, please vaccinate your child if they're eligible, and just put a mask on them, please.
Dr. Ledke, I know you mentioned natural immunity and how that might be impacted by Omicron, but a question has popped up, so maybe we could just review. If you were infected with Delta, are you protected from Omicron, at least for a period of time? That would be the first question. And then I would just ask you to comment on natural immunity versus immunity from a vaccine, because I think there continues to be confusion about which is more powerful, which is more long-lasting.
Sure. So with Omicron, that is a key question, is how well does prior Delta infection prevent against Omicron? And there is more information we need to obtain from this. The information we have is fairly preliminary. A couple data points. There was a report out of the United Kingdom that I mentioned earlier that showed that the risk of reinfection with Omicron is significantly higher than Delta. Most of the patients in this study had probably been infected with Delta, although this was based on seropositivity, which doesn't necessarily, by that I mean antibody positivity. That doesn't necessarily imply which strain it is, but it would very likely be mostly Delta. So a significant higher risk of reinfection with Omicron based on that study. I will also point out that the United Kingdom was in the midst of a significant long-standing Delta surge when Omicron hit, and they have continued to surge higher than before with Omicron amongst a population that likely had high exposure to Delta and probably high baseline seropositivity to Delta. So it looks to me, although it's preliminary, like infection with the Delta does not confer very good protection against Omicron, but further studies need to be done for more clarity. So to me, that tells me that if you have been infected with COVID and your mindset is, I do not need a vaccine because I've been infected with COVID, that is out the window. That is no longer viable. Even if you have been infected, you need to get vaccinated. So please do so. In regards to whether vaccination or natural infection is more sustainable, we don't know that with Omicron. It's way too early to know that. There were some studies with preliminary variants, with previous variants that were a little bit contradictory. The more recent studies that I've seen have suggested that vaccine-induced immunity is more robust and long-lasting, but that's not the case in every study I've seen. Of course, vaccination-based immunity is much more preferable because it prevents the patient from getting COVID, which is the point of all of this. So so in general, vaccine-induced immunity has been found to be stronger in prior variants, but we don't know that in Omicron.
Dr. Nefsi, as we try to anticipate what will happen with Omicron once it reaches the region, and we look at the current status of the healthcare system, there's obviously concern about what that will mean in terms of strain. Can you just talk a little bit about the work that is ongoing in regards to expanding capacity if it's needed, patient placement to keep things flowing through hospitals and ERs, and the teams that are meeting to address concerns and be prepared for whatever comes next?
Well, as stated previously, we are still in pandemic level red, which means the majority of the work that we're doing is really about the COVID-19 pandemic and our response to it, and basically, keeping the doors open, our staff safe, and our patients cared for. So that work continues. We continue to meet regularly with the state, with the Department of Health and Human Services, with the governor's office, with our health department colleagues. We continue to work together as a system to try to level load those patients and ensure appropriate transfer of those that are sickest that need to be at the medical center, as an example, rather than at one of our critical access hospitals. And we will continue to prepare. I mean, we see our numbers going down. That in no way means that we're, taking a break and kicking our feet up. We continue to work daily to ensure that we are open and available for our patients who need us.
Thank you, Dr. Nefsi. Dr. Ledke, I know we've talked a little bit about this earlier, but it probably bears repeating. What is the advice regarding travel as we go to gather with as people go to gather with family over Christmas and New Year? How should people proceed? What is the safest thing to do, and absent of that, what is the next safest thing to do?
Yeah, this is like the $1 million question. A lot of people have been asking this, and so obviously the safest thing to do is to not travel, to not see loved ones. That's probably a lot. I mean, that's a lot to ask. I think what I would recommend is a thorough risk assessment. Okay, meaning who are you going to be with? How long are you going to be with them? Are they vaccinated? Are they going to mask when they're inside? One, I think, useful strategy would be doing an in-home test the day of, or maybe the day before and the day of a major family gathering, including those who are vaccinated. So I actually just had a Christmas gathering last weekend downstate with a group of people, all of whom were vaccinated if eligible, and we just all tested the day before and the day of. So that's one thing to think about. I would urge that that discussion on vaccination, don't be afraid to have that discussion. So if you're anxious about your family spending time with loved ones, then feel free to bring that up, to ask that question. Don't be afraid to put your family's health as a priority. So I guess it's really hard to say, across the board that it shouldn't happen as far as gatherings. I would just say be cautious, think about the risk, consider testing if it's a large high risk situation, and don't be afraid to ask your family about their vaccination status.
Dr. Ledke, Dr. Nefsi, thanks so much for your time today. We are just about out of time, and always appreciate the good information.
Thanks, Brian.
All right, let's go back to the slides for just a moment. And in regards to getting a vaccine, finding out where to go, finding out how to get tested. There are a lot of resources out there. 211 Michigan, the Area Agency on Aging of Northwest Michigan. Of course, we have all of our regional and local health departments, and those websites are listed right there on your screen if you need more information. Next slide, please. And of course, you can also find plenty of information at munsonhealthcare.org. Another great resource that is free is the Ask a Nurse hotline at 231-935-0951. You can also sign up for our newsletter or follow us on Facebook, LinkedIn, Instagram, Twitter, and YouTube. We'd very much like to thank you for being here and taking in all this information today. We plan to be back here 1 week from today. And until then, please stay safe, be well, and happy holidays.